It's me, Dr. Marty Ross again, and tonight is another one of our conversations with Marty Ross MD. As you know, this is a webinar where we're going to talk about Lyme disease. So what I want you to do is write your questions in the chat box. That way we all can see that question. I'll still read them out loud, but that way everyone gets a fair chance to see it. The other thing that I want you to know, I am making a recording of tonight's webinar, and so if you happen to miss something, you'll get an edited copy of that. Get posted up tomorrow morning, and I've been creating a little bit more of extensive summary of those webinars and the video. If you watch the video within Lyme United, it has little stamps on it that you can go right to the section you want to if you need to too. So just be aware of that. As you write your questions tonight in the chat box, try to send them to everyone so that all people can see. Don't send it just directly to me. And then the other thing I ask about that chat box function as well too is try to not do chatter back and forth to each other, because I will wind up seeing that and it'll get clogged up. It'll be harder for me to follow the question. So that's my request on that one too. All right. So then as I take each person's question at the end, I will ask others if they have any input or any further questions. So you all get a chance to pipe in there. And then sometimes as we go through questions, I wind up asking, have you open up your camera or your microphone so that I can ask you more direct questions to help me answer it too. Okay. All right. So good to be here with you. We've got to figure out what we're going to do. Probably, what are we at here? Yeah, I guess next week would be Christmas. So we won't be doing next week. This is going to be our last one. I have to figure out what to do for the week of New Year's. I may do it on a different day, but anyhow, we won't be on. So this is our last one for 2 weeks here. Okay. All right. So yeah, let's go ahead and get started here. So hello, Missy. Missy says, I was terribly confused before I found your information, well-organized website. The search feature has answered many questions. You're a real gift that keeps giving. Thanks, Missy. I need to put your endorsement on my website, I think. I appreciate that. Thank you very much. All right, let's see here. Part one of Missy's question. Okay, you do have a question then. Okay, let's see. Advise what meds and dosage to address my worst symptoms of daily pain and migrating, tingling, fluttering on and off since 2018. Normal, large, and small nerve tests, brain MRI, B12, and autoimmune test, biopsy significantly reduced sweat glands, first day of Mepron and 2 azithromycin, most intense widespread and tingling, following days with azith less intense. 7th day, strong heart palpitations, fluttering, aching, tight chest muscles, tingling less after stopping drugs day 9 and started 2-glutathione curcumin, less night first time took your 3 herbs of the crypto Japanese knotweed, the CCO oil and artemisinin. I am briefly dizzy when first got up, then felt drained. Previous dizziness usually due to ear crystals, but negative for this time. Daily numerous aches are my worst and most long-standing problem. Some migrate, joints, tendon, muscles. Celebrex doesn't help. Images show osteoarthritis and tendonitis. Rheumatoid arthritis and rheumatology test normal. See part 2 with questions. Part 2. Should I try 3 herbs without artemisinin 1 time a day, or Mepron or Malarone and azithromycin? Could 3Bs dry up, inflame so many joints? Sorry, I don't know. I don't show my video due to poor internet connection. Okay. So, Missy, I need to know a little bit more information. I'm wondering if you could at least turn your microphone on so I could ask you.
Sure.
So, Missy, do you know if you've been do you have laboratory testing suggesting that you have the 3Bs, or how do you know you have them?
Positive fish or babiosis.
Okay.
IGeneX 2, IGeneX positive for Lyme, 2 bands.
Okay. Okay.
And the Bartonella was indeterminate.
Okay. Okay. So in terms of the if you're looking for an herbal treatment that could address all three, that Cryptolepis, Japanese knotweed, liposomal cinnamon clove, oregano essentials would cover all three. The Cryptolepis is useful for Babesia. The clove and the cinnamon clove oregano is also useful for Babesia. The Cryptolepis Japanese knotweed, both of those are very effective at treating growing and persister hibernating forms of Borrelia and Bartonella. The CCO also does that, and the CCO can help clean up biofilm. So that it's a good treatment. You don't necessarily need to do that with the artemisinin, if that was what your question was. Have you tried that already or not?
I just tried it the first time. All those three, your herbs for the three Bs.
Yeah.
I tried and artemisium. I tried them
Yeah.
for the first time last night, and oddly, I woke up in the morning feeling dizzy briefly. Um,
Okay. Okay.
and so, you know, I'm happy to try and take them, but I was just wondering if you think that dizziness might have been from the artemisium or what.
It's hard to say. The
Yeah.
problem is, with this illness, you can get dizziness as part of just the underlying conditions, or you just get dizziness because dizziness happens sometimes separate from Lyme as well too. If you were to have ongoing dizziness that's related to having started these herbs, like it keeps happening, then you may need to consider starting and stopping different ones to see if you can figure out which one may be triggering it. But I would not say dizziness is part of a regular side effect profile of any of those.
So you think trying the crypt, the JK, and the CCO, and
Yeah.
then maybe adding the art later,
Yeah. If so,
or
if so generally, most people don't need to have artemisinin with that mix of herbs that you just of the crypto, Japanese knotweed, and the CCO. So
oh, I
yeah.
see.
So what you might want to do is just go with the crypto, Japanese knotweed, CCO, and see where you get over a couple months. If
Mm.
you find you're not progressing enough, then at that point you might want to consider adding artemisinin in at that point. Okay. The other thing is stepping in, these three herbs together it's going to be a pretty intense treatment. So you're going to have your hands full potentially with Herx reactions and everything. So I would probably just postpone that artemisinin at least for a couple months on that.
And uh,
Got it.
that wasn't me.
No, I know. I figured out who it was. Don't worry. Yeah.
Okay. All right. So, and you think just trying that, see how it goes for a couple months with those herbs,
Right.
and not try the Meprone again and the azithromycin. I only did those for 9.5 days.
Yeah.
Um, okay.
So the choice is yours. What I will let you know is the herbal combination is going to work effectively against Babesia about 80% of the time, versus a Mepron azithromycin may work about 85% of the time. You get about 5% increased chance that those prescriptions will help. But I don't, 5% isn't much of a difference. So you just might want to try the herbs and see where you get with that. You have less harm to the gut microbiome that way. You have less antibiotic side effects that way. So it's a good starting place, basically.
Should you still take that, what is it, the sacro um thing for even with the herbs though? Or
So, to take a look at the Ross support protocol, because, getting over tick-borne infections is not just about killing germs. You have to deal with all of the abnormalities created. And so in the Ross Lyme support protocol, I talk about making sure you're getting sleep, and I recommend herbs you can use if you're not getting sleep. I talk about the need to lower inflammation chemicals called cytokines. Using curcumin is what I prefer. And that may help with a lot of that joint pain issues you're having as well, too. I talk about the need to either eat a diet that's rich in plants, or if not, then be on probiotics and prebiotics. well, actually be on probiotics anyhow, but if you're not having a plant-based diet, you may need to take prebiotics and something called polyphenols to feed good bacteria in your intestines, so you protect your intestinal microbiome. Okay. But literally look through all the steps of the raw support protocol to see the other things you need to be addressing as you're killing your germs to get well.
When you're taking your herbs, uh, there's one probiotic that you take when you're taking antibiotics. I forget the name of it. Is it sacro something?
Well, so
Should that be taken also?
not necessarily.
Oh, okay.
My preferred, so I would again let me just
I'll
show it.
just look at, I'll just,
Yeah.
no, I'll see it.
Okay.
I've gone through it. I just don't remember everything because
Okay.
I'm new.
So, yeah. So there's two probiotics, depending on what kind of gut symptoms I would recommend. Either a product called Metabolic Daily, which has some Akkermansia in it and some other bacteria that ferment and cause butyrate to be made. Butyrate helps your intestinal cells work better and heals any gaps between them. Or if you're not having a lot of GI symptoms, you can use a spore-forming probiotic, like a core biotic, would be useful. So you could use either one of those, but it depends on what's
Okay.
happening with your GI symptoms.
And is it okay if I start getting the tingling being really intense to just continue with your herbs?
Yes,
Um,
but
okay.
make sure that you're doing the things to lower cytokines like the curcumin.
Yeah,
And
I
I would,
started that and the
yeah,
glutathione, and those
yes,
two things seem to have reduced it some.
yeah, and you're okay pushing through it as long as it doesn't become severe. If it becomes severe, you might want to back down, like decrease the dosing on your treatment, because some
Okay.
of that tingling may be part of a Herx reaction. Are you familiar with what I mean by Herx reaction?
Yes, I am.
Okay,
And the tingling, as I mentioned, was there before.
yeah.
Um, and could the three Bs affect so many different areas of the body?
Oh
I
my,
mean,
yes, yes,
20 different areas?
yes, yeah.
No?
But
Oh,
consider
okay.
the infections are literally throughout your whole body.
Yeah, okay.
Yeah, that's very possible.
You're a real godsend. Thank you so much.
Good luck to you, Missy. All right, let's see here. Bear with me. I'm just removing those part of her questions so that I can see what else is here. So, oh, by the way, did anyone else have any comments about what Missy and I were talking about, or should we just move on here? I think we'll just move on. All right. So next question is from Jennifer, Jennifer Algier. Hi, Dr. Ross. I've been diagnosed with mold, Bart, Lyme, was taking modified citrus pectin, recently started back on itraconazole, have been experiencing acres of slime. Is this mold here? Dr. Neil Nathan recently stated no MCP with mold. Thanks. So Jennifer, I guess I got some questions here. What do you mean acres of slime? What are you seeing?
Um, it's just like when I lay down, I mean, it's like my mouth fills up, I'm coughing it up. It's mainly all up here. My mold
Okay.
is here, I
Okay.
think. So, and then it's it's just so extreme. And so it was supposed to say mold Herx, but I guess my autocorrect went in. I didn't know if that was a Herx or if it was just the citrus pectin breaking everything down so much that I was more slimy. Okay.
Well, question, you also said Dr. Nathan recently stated no MCP. What do you mean by MCP?
Modified citrus pectin.
Oh,
He said don't use it with mold. It was like, I guess I was on the website and I guess it would release too many toxins. I just read that like
that I don't understand. I don't agree with him on that because I use citrus pectin often as my main binder and people do quite well with it usually. In fact, I use it as a broad spectrum binder, meaning it can pick up a number of the different kinds of toxins,
awesome.
and it tends not to be constipating. In terms of binders, cholestyramine, which can also be broad spectrum, tends to constipate. That's a prescription. Your GI detoxes and Mycopol by Research Nutritionals, those two products are very similar in what they have in them. They have some charcoal, some clay, some humic acid, fulvic acid. Those products sometimes constipate a little bit, but the pectin, just of all of them, tends not to be constipating. So I've used that. So I don't agree with Dr. Nathan on if there is something he said that way. I don't agree with that. So you're saying you're getting very mucusy right now since you started.
Yeah.
Is that what I'm understanding?
Yeah, I guess so. It's a different consistency, I guess, because it is breaking down some of that mucus.
Yeah.
I just didn't know if it was okay, basically.
Yeah. So did that increased mucus come on as you began the itraconazole too, or was it before that?
I think it was together because I had stopped itraconazole for a little while because we thought I was better from the mold.
Yeah.
Based on a mycotox panel wasn't actually true. So mold started coming back, so I went back on it.
Okay.
I don't know.
I don't have a solid explanation for it. I mean, I acknowledge you've got it happening, but the one thing that I would wonder about is as you're killing mold, mold spores, if you have mold colonization, and not everyone with mold toxicity does have mold colonization, but if you do, if you've got mold spores living up in your sinus passages and they could be releasing toxins themselves, they're their own brew pub in a sense. As you start killing them, it's possible that your body's mast cells, your allergy cells, are seeing those parts and reacting in an allergic way by making a lot of histamine. And histamine is going to give you a lot of that mucousy stuff. Are you on any quercetin by any chance?
Yes, I am. I actually increased the dose recently because all this stuff was going on, and the whole mast cell activation kind of makes sense just based on my symptoms. I'm working with a doctor, but I'm having to do a lot of this sort of myself too, unfortunately.
So, and if the quercetin herbally is not holding well enough, you might also want to look at or try as an alternative a product by Research Nutritionals called Histoquel, which has quercetin in it and a number of other herbs that stabilize the mast cells. I believe there's luteolin in there as well too, and it'd be a couple pills twice a day. The other thing, so those are stabilizers of your mast cells, okay? But if you're having a lot of excess histamines leading to the mucus, sometimes you need to use histamine blockers, and so those are drugs actually. So over the counter, you could do a Zyrtec, for instance. 10 milligrams once a day often can be helpful, and if that's not adequate, then sometimes we'll add in acid medicines made to limit acid in your stomach, but they also have antihistamine effect. And you would go with something like a Pepcid, for instance. Okay. But those are some things. And then also look at my, I have a whole article on mast cell activation. I can show that to you, or just search mast cell activation. You'll find it on my site, where I kind of list what you do if, alternatives, what you do if the stabilizers, the histoquels or the quercetin don't work. It talks about the Zyrtec, it talks about Pepcid, but it just kind of goes through some other steps you might want to look at as well too.
Okay, thank you so much. That's
all right.
Awesome. Yeah. Thank you for doing this too. It's just awesome.
You're welcome, Jennifer. Good luck to you.
Thank you.
All right. Let's see, Tracy, I see your hand up there.
Hi. Just wanted to ask something about that. Do you have any experience or any input thoughts about Ketotifen as a mast cell inhibitor?
Yeah. So Ketotifen is interesting. So Ketotifen is both antihistamine. So Ketotifen is made only for an eye drop. So that's how it's manufactured. So if you're going to get Ketotifen, you have to have it compounded by a compounding pharmacy. So I want to be clear to everyone, it's not an herb. This is a prescription, and you need to find a provider that would be willing to prescribe it through a compound pharmacy, who would then take this antihistamine medicine and turn it into a pill. Okay. Now, the thing that's nice about Ketotifen is, in addition to being antihistamine, like Zyrtec is antihistamine, a histamine blocker, it's also a mast cell stabilizer. So you kind of get an all or one out of that. Often when I would think about using Ketotifen is if my herbal stabilizers are not working, if my histoquels or my quercetins aren't working, and I've got somebody on Zyrtec and I've got somebody on Pepcid and we're still really, really active, then I might go add a Ketotifen in on top of all that, basically.
And how does one dose that? What's the thinking?
You know, I'm going to blank off the top of my head here right now. Unfortunately, I'll see if I can get back to you on that one. Okay.
All right. If not, I'll follow up in office hours and
yeah. Okay.
do it that way. Okay. Thank you.
Sounds good. All right. Good. All right. Let's see, Phoenix. I see your hand up there.
Okay, sorry. This is my
Hi.
first time ever being on the platform here, so it's a little.
Woo! All right,
Hello.
welcome here.
Hi. I've been
Hello.
meaning to do this for a while, so.
So what was your question?
So my question is, you know, I've had, I'm 50, well, I'm going to be 57 January 1st, okay? And I have had Lyme disease since I was 20. And, you know, for the first time ever, I did not test positive for Lyme disease for IgG or IgM. So I'm celebrating. That's a win. However, I am testing for anaplasmosis and for rickettsia, and Bartonella was indeterminate. I think I could have got it from my cat biting me. Yeah. Or it could just be a tick that bit me like 2 summers ago, and like I was in my system and it didn't come out until I got really run down when I was putting my mother or helping my mother move into an assisted living and handling her medical care in October. I just got totally run down and my adrenals crashed out. Like I have like 6 for my adrenals. Like it's not enough to just get through life. Like I have to take steroids now. But the point is, I'm just wondering, how do I treat this rickettsia or this anaplasmosis? Is it the same? Because it's kind of different than Lyme, than Borrelia, right?
Right. Yeah. So let me just clarify something here. So what I was trying to do is take follow-on questions to what we are already talking about. So you haven't, yeah, but I'm going to answer it here this one time, but I just want to let everyone else know, write your questions in the list and I'll get to them as we can. Okay. But I'll answer yours real quick here for you. Okay.
Wait, I just want to make sure I need to write the questions in a list in the chat or something?
In the chat box. Yeah. So write your question in the chat box and I kind of take them in the order that people, and then after I answer somebody's question, I'll ask if anyone has a follow-up on what we were just discussing there. Basically.
Got it. Okay. I'm sorry.
So you have a whole new question, but I'll just briefly answer it for you. So Anaplasma is best treated using doxycycline. There are not, although I advocate using herbal antibiotics for a number of tick-borne infections, I just don't find herbals to work well for Anaplasma. So Anaplasma, I recommend tetracyclines. Do you know, which is doxycycline is one of those. Have you been treated with a tetracycline in the last couple of years?
I'm allergic to doxycycline. I tried taking it when I got bit by that tick and I just had like my throat was swelling. And so, yeah, I can't do it.
Do you have any symptoms that say anaplasma? In other words, usually people with anaplasma are going to have a lot of body pain and maybe even temperature.
Pain in my body. That's why I knew something was really wrong. I was like, what is going on?
Right. So as an alternative to doxycycline is rifampin, which is another prescription antibiotic, would be your choice for anaplasma.
What's that? I never heard. I mean, I'm almost allergic to all antibiotics because I went around and around with that line for 30 something years. And it was
got it. Yeah, I got it. So it's another prescription antibiotic, unfortunately. I don't have an herbal alternative for you.
Okay, so you don't think ivermectin will hit it?
No.
Really?
So ivermectin is designed to treat a certain kind of intestinal parasite. There is no data saying that in laboratory experiments that say that it treats any tick-borne bacteria. There is limited data that, well, actually, we're going to strike that. It does have some activity against Babesia, but it does not treat bacteria. So it does not treat Borrelia, Bartonella, or any of the tick-borne infections. There's just no data that says that it does, nor was it designed to do that.
Okay.
Yeah,
I mean, I was just wondering if it would even slightly hit it since I can't really use the antibiotics.
Unfortunately, no. Yeah, I mean, so I hope you have like a Lyme literate doctor you're talking with to see if they can help you find an alternative there or help you through using a rifampin if that's what you need to do.
Well, they wanted me to use something that's really expensive, which is, ozone IVs with light therapy, like
Yeah.
it's hemolumin, but
Yeah.
it's like $300 a pop sort of
Yeah.
therapy.
And even that I don't think has good killing. So people do feel better when they use ozone or oxidation treatments like that. But the main reason probably is because those oxidation therapies give more oxygen to your cell energy factories called mitochondria. So you get a burst of energy production, you feel better. But when we look at studies about whether ozone, IV vitamin C, UV blood radiation, whether they actually kill germs, they don't. And there's an experiment done looking at ozone. You take a tube full of bacteria, you put ozone in, kills all the germs. You take the same tube full of bacteria, you put one small drop of blood in that tube, you put ozone in, there's no killing. And the reason there's no killing is your blood is full of antioxidant. It neutralizes the killing properties of the ozone. So I know there's a number of doctors out there that try to get people to do ozone and hydrogen peroxide and all that stuff to kill germs. And they report it must work because people feel better, but the studies tell us that it doesn't kill germs. It may help you feel better because your mitochondria are working better. Okay, so just be aware of that as well too.
Yeah, I mean, I was wondering because it is a combination of ozone, 10-pass, and then it's also the BB. It's like the two together. So
yeah, I don't see those as decent germ killers. That's my opinion on that, at least.
Yeah.
Okay.
So rifampin, what family is that in? Rifampin.
It's in a family of antibiotics called the rifamycins, and it would be 300 milligrams twice a day or 2 pills 1 time a day.
For
But
how long? Like
you'll usually about 2 weeks.
Oh, just 2 weeks.
Yeah.
And is that like, is it related to like Zithromax or, I mean,
It's a separate family, Yeah.
penicillin? I'm trying to see, like, am I going to be allergic to that? Like,
I don't know if you will or not, but it's a separate family from all of those.
and it's not part of ciprofloxacin and all that crap. So
No.
I hate. Well, maybe I will be able to take it. I don't think I've taken that one before.
Just do a quick screen share. So if you're looking for information on this, take a look at my Lyme site, and then I'm going to just type in anaplasma. So here's my article on how you take care of anaplasma and Ehrlichia. And in here, I talk about there not being good herbals, but the 2 prescriptions you can use are Doxy or rifampin for 2 to 4 weeks, basically. Okay. You could print this off, right click on your computer, print this off, and take it to your primary care doctor and see if they'll prescribe for you.
Okay, just did that. I think I did that.
Yeah. All right.
I'm on an iPad, so I don't know what I did.
All right. So I'm going to move on to the next questions here then. Okay. Good luck to you.
Thank you so much.
You're welcome.
Really appreciate it.
All right. Let's see here. So let's get back into the order of questions here. All right. So the next one is from Karen. Let's see. Hi, I'm an AI assistant helping Karen. You need to name your AI assistant, Karen. Give it a name. Anyhow, I'm teasing you. Don't worry. I use AI quite a bit myself too, but I'm an AI assistant for Karen Wideman. Take notes for this meeting. Oh, this is telling us that you're actually recording it. I got it. Okay, that's not a question. Good. All right, the next one, this is from Teresa. Hi again, Dr. Ross. Could you explain the benefits of the product Capri Plus for the yeast? Will help the sugar cravings. Thank you. So Capri Plus is a product that's made by a company called Karuna. And it has 3 different components to it. It has garlic in it. It has caprylic acid in it. And it also has oregano oil in it. All right. So those are all herbs that have been shown to kill yeast. So it's a yeast killer. It does not directly have any components in it that also decrease sugar cravings. However, as you get rid of yeast, you will have less sugar cravings because it's the yeast infection that's telling your brain, is sending signals up to your brain that says, feed me. And so, but as you get the yeast under control, now typically with a herbal compound like a Capri Plus, it's going to take about 2 months total time to get your yeast under control. You will probably start feeling better at 3 to 4 weeks, though. The dosing I like to use for that product is 2 pills twice a day. And then be sure, if you're treating yeast, to be on the various probiotic options that I cover in my article called Kills Yeast. So if you got a lot of GI symptoms, be on the Metabolic Daily that I mentioned earlier. If you don't have a lot of GI symptoms, you could use a core biotic, which is a spore forming probiotic as well too. Okay. Did I answer your question for you? All right, good. Thank you. Does anyone else have a question regarding yeast here real quick, or follow up on what Teresa was just asking?
Actually, can I add one more thing in?
Sure, sure.
Okay. So if we go back the past couple of weeks, I'm on fluconazole and I'm on my statin, but I'm getting that burning tongue sensation.
Yeah.
And then all of a sudden I was doing well, and now the sugar cravings are like, I can't stand it. It's like being an alcoholic, I just got to have it. I got to have it. And so
Yeah.
that's where I remembered you saying something about that product last week.
Yeah.
And I didn't quite retain it and understand it. So
You could add it to what you're currently doing with your fluconazole and nystatin and see if you get better benefit. The other thing too, if you're getting burning in your mouth, you may have the even though the fluconazole is supposed to get in the blood and come back to the mouth, and even the Capri Plus get in the blood, come back to the mouth, nystatin doesn't. Nystatin doesn't get absorbed; it just stays in the intestines. So in those cases where you've got it in your mouth and you're not doing well with the oral, sometimes you can see if you can get your provider to take the nystatin and turn it into a drops that you take, and then you swish and swallow it around your mouth, basically. Okay.
yeah, because it's like burning tongue syndrome. Yeah.
Yeah.
And then I'm also low on B's, so I don't know if it's got to do anything with that, but
Sure.
yeah.
All
I
right.
think it's more of the yeast. Thank you so much. I appreciate you.
Good luck to you.
Thank you.
Tracy, I see your hand up here still. Is this from before?
Sorry, I forgot to unraise it. Yeah.
Okay,
it's
good. So
from
you don't have
before.
a new question there then. Okay, got it. All right. Let's see. All right. Does anyone else have a comment about Teresa's yeast? All right, let's move on here then. Hello, Robin. Let's see. After having Lyme, Babesia now for, what does that say, 1 year, I think. I can't say what's happening is I've got this. I'm being blocked reading your question by, there's this thing hanging over it, but anyway, I think you're saying 1 year. Anyhow, and various treatments, none with a consistent doctor.
12 years.
12 years. Okay, thank you. I knew I was missing something there. For 12 years now, none with a consistent doctor. I wonder if in your experience, if air hunger can be cured, and if you have seen it turn into COPD. I had to go to standard doctors due to cost, and I'm diagnosed with COPD and polyarthritis now. I treated Babesia one time for 4 to 5 months, and I was able to breathe again. Yet here I am 2 years later diagnosed as COPD because I have not been able to afford to go back to my Lyme literate medical doctor. Finance is somewhat better now. I'm starting from scratch and retesting for Lyme and Babesia for my genetics. Tested positive a few times with Lyme, Western blot, but I'm concerned if my lungs have been damaged and fear treating for Babesia again. Thoughts? Okay, so question for you. When your doctor said COPD, did they have you do breathing test to make that diagnose?
Yes.
Okay, so there's some documentation actually showing that it is COPD then.
Yes. And when I discussed having Lyme / possible Babesia, he was somewhat familiar with that, but
Yeah.
no doctors admit to that if they're not LLMD. Not in Orlando, Florida.
So then let me ask something too, that do you have any history of smoking at all?
Yes.
Okay.
But it
So
was
these-
one of my first symptoms.
Yeah.
When my first symptoms were air hunger,
Yeah.
Epstein-Barr. I lost my speech,
Right.
brain fog. I was put on Rocephin IV immediately for
Yeah.
28 days by an infectious disease doctor. However, I still had symptoms after, and
Yeah.
that's where trouble began, because most of my mental symptoms went away, but
Sure. Let me make
the
a
rest
comment
of my
here.
symptoms, I've been going all over the place to try to manage
So,
them.
so about the air hunger, COPD, and Babesia, it is so clearly you have a risk of COPD from smoking. You've got some testing showing COPD. However, we have to be careful to say just because you have that diagnosis, it could also be that your breathing now is not the issue is not from the COPD, but maybe the Babesia is active.
That's
Okay.
what because that was one of my first symptoms.
Yeah.
And, and I did go to Dr. Daniel Cameron,
Yeah.
flew to New York, and he had me on treatment. Um, and I was phenomenal, but I don't think I was on it long enough.
Yeah.
And it is very expensive. However,
Mhm.
I'm going to try to get someone local that may be able to follow me now that is just a PA.
Right. So then let me just ask you a few questions. These are just Babesia oriented questions. So air
Okay.
hunger can be from Babesia. It could be from COPD, or maybe it's like the two of them working together. Okay.
Right, right.
To answer your question, no, the tick-borne infections do not cause COPD. I have not seen that occur. All right. But that doesn't mean having tick-borne infections won't make your symptoms of COPD worse and
Okay,
vice versa.
okay.
Okay. They
And
can,
that's what I'm going with. Thank
yeah,
you.
yeah. Okay. And then, so in terms of looking at Babesia, things that suggest Babesia to me are air hunger, night sweats. Do you have that at
I
all?
had those extremely. I
Yeah.
no longer have them any longer.
Okay.
But at one time they were extreme.
Okay. Do you got any headaches at all?
I used to have them all the time.
Okay.
A
But they're
little
gone now.
better.
They're
Yeah, a
better.
little better with the headaches.
Okay. Do you have any racing or skipping of your heart on a regular basis?
I had quite a bit of palpitations. I'm now on 2 different high blood pressure. Again, after the Rocephin,
Yeah.
I was put on blood pressure medicine, cholesterol. I had no issues before all
Okay.
this Lyme, but
What
now I'm
is
currently on 2 blood pressure medicine for that palpitation.
and what is your energy levels like these days? 10 is great.
0.
0. It's really
Yeah,
low.
yeah,
Did your energy getting really low coincide with your feeling air hunger again?
absolutely.
Okay. So you're not having all the Babesia symptoms like you did before. Okay. So you
No.
don't have,
And
the
yeah,
headache and the sweats and all that. All right. But you've got some stuff that make me wonder about Babesia. That's the air hunger is back. Because I would bet you even had COPD years ago too. Okay. I mean, it didn't just happen yesterday. Okay.
right, right, right. I ignored it for quite a few
Yeah.
years.
And COPD is not going to give you the complete exhaustion the way that Babesia can. So that the fact that you had it before, and yes, it does sometimes return. We don't get rid of it all the time. Coupled with low energy and air hunger, if I was treating you, I would consider trying a trial of treating for
I
Babesia.
also have major eye issues.
Mhm.
I had cataracts very young, had
Yeah,
them done in both eyes, but they continue to feel like there's baby oil in them,
sure.
and continues to feel light sensitivity. At one time, I had noise sensitivity.
Mhm.
Now I only have light sensitivity.
Mhm. So I hope you could find somebody to treat you.
So, your thoughts on starting from scratch? You feel confident?
So you either find somebody to prescribe again for you with what the kind of treatment that Dr. Cameron worked for you. It seemed like it did work back before. Or if you can't find somebody, you may want to take a look at some of the herbal recommendations I have to treat Babesia. You will find those in an article called Kills Babesia.
Right, I've read that.
Yeah,
Now,
take a
I do get anxiety and panic attacks. Not to interrupt, I'm sorry.
yeah,
I order a few of your supplements, and I do research it into your book.
yeah.
But Bach, Aspen drops. Are you familiar with those?
No, I'm not.
All right. Supposedly they take away anxiety,
Mhm,
panic,
mhm.
fear. Unknown
Oh,
fear.
the Bach remedies. Yeah, they work homeopathically or energetically to treat. The Bach flower remedies can be useful for anxiety sometimes. But that
Right.
anxiety may be part of the Babesia for you too.
Yeah, I believe that. Yeah, and I didn't know if you had those supplements in your,
No,
or the
no, I
drops rather.
don't carry any of those, unfortunately.
Okay. You
All
are
right.
phenomenal. Thank you
Good
so
luck.
much.
Yeah, good luck to you.
Thank you.
You're welcome. Does anyone have any follow-up question to what Robin and I were just talking about? All right. Phoenix, I think I see your hand up there.
Yeah, I just have one comment or question. Does Cortum work well on the Babesia thing? Cortum? Do you know what I'm talking
Coartem. So,
about?
yeah,
If I
so
can
it's
interrupt, that Cortum was phenomenal
Yeah,
when
that
I
fixed
took
me.
it.
yeah.
However, the pharmacies could not find it. I went everywhere to search for it. But when I was on that initially, I felt brand new. I was
Me too.
amazed.
Yeah.
When
So
I had Babesia.
it's
I don't
interesting. So in my experience, I used to use Coartem mainly as a drug if everything else was not working. And in general, in those type of situations, I didn't find it that useful. So it's interesting that you both had success with it. Some people do. I don't put it as my first go-to medicine. I'll put it that way. I think there's better options out there, but it is something to consider.
Why am I unable to find it?
I don't know at this point if there's a drug shortage on it at all or not.
It was hard to find back in the day, but
Yeah.
I did it for like 6 months, and then I stayed off for like a summer, and then I went back on for another 3 months, and then the Babesia is gone. I mean, I didn't test positive for it this time, and I've been fine, and I don't have any more air hunger like that. So
Good.
it worked. But I mean, I don't, like you said, I don't know if it's available or like if there's something better or, you know.
Yeah, I went to pharmacy, all different counties and was unable to find it. I'm glad you mentioned that. Thank you so much.
Order it from India, of course.
Yeah.
All right. I'm
Just
gonna move on.
saying.
I'm gonna move on to the next question here, okay?
Thank you.
All right. Let's see. Lee. Hi, Dr. Ross. I managed to navigate my way through Lyme and Babesia. Then came the mold. I managed to detox from aflatoxin, ochratoxin using cholestyramine. Then black mold showed up. I was doing 2 capsules of GI detox with 2 tablets of chlorella for about 9 months. I suddenly became brutally sick and could not tolerate any of the supplements I had taken for years. I have tried a few times to start the GI detox again, but cannot handle the side effects, side pain, skyrocketing blood pressure, facial flushing. Now I have developed possible lung issues and need to restart the detox safely. Any suggestions? Thanks in advance. Okay, so a couple things to think about when everything goes haywire and the things that you used to do don't work anymore, right? So number one, mold is one of the mold toxicity is a big trigger for something called mast cell activation. So your mast cells we used to think of them as classically being your allergy cell. If you were allergic to cat dander or pollens, they would land on a mast cell and a mast cell would just make histamines, okay? What we now know over the last 10, 20 years is that it isn't only things you're allergic to that trigger your mast cells. It's actually tick-borne infections, mold toxicity, other kinds of toxins. All of these things turn on your mast cells to more readily start releasing all their histamines. And those histamines give you flushing, they give you brain fog, they give you classic allergy symptoms like runny nose, watery eyes, mucus production, but they also make it so that they're so turned on that you start reacting to anything, basically. So consider that you might have mast cell activation as part of this. Okay. Secondly, one of the big things, and I know if you all have been reading some of the responses on my site or been on the webinars before, you're probably going to all groan as I say the next thing, but always, when things go haywire, think about intestinal yeast overgrowth. And the reason is that being on antibiotics somewhere in your treatment, even herbal antibiotics somewhere in your treatment, that leads to disturbances of the healthy bacteria in the intestines, which makes it easier for yeast to grow. Too many yeast in the intestines are a big trigger of your mast cells too. All right. In addition, those yeast in your intestines trigger your immune cells that line the intestines to start manufacturing a lot of cytokines. Keep in mind, most of your Lyme and mold toxicity symptoms are also due to excess cytokines. So a major thing you could be feeling worse all of a sudden is that too many yeast in your intestines are triggering cytokines, okay? So if I were to be working with you, I would want to explore with you about ways to stabilize your mast cells. And first place I would start usually is with quercetin. It's a 250 milligram pill. I'd start at 1 pill a day. Once you're stable on that, if you can, I'd go up to 1 pill twice a day. Once you're stable on that, if you can, then I'd go up to 1 pill 3 times a day. And I would eventually try to work up to 500 milligrams or 2 pills 3 times a day. All right. Now, quercetin is good because it stabilizes your mast cells. In addition, it has anti-cytokine effect too. Okay. And then the other thing I would be looking at is trying to determine, do you have too many yeast? And to do that, I can show you the article that I've written about how do you determine if you have too many yeast. And if you do, then once you're on the quercetin, then you need to start working slowly with yeast killers to bring that down as well too. Okay. So let me just show you those 2 articles to take a look at. Somewhere here. Screen share. There we are. Okay, so again, regarding mast cell activation, this is the article, okay? And in here, I talk about all the potential triggers of mast cell activation, and then I walk through things to do. One is decrease stress. Stress is a huge trigger of your mast cells. Second thing you want to do is get rid of anything you know you might be allergic to. Try to get your infections under control, remove toxins, lower cytokines, but the main thing you need to do is stabilize your mast cells. And what I'm suggesting for you, given your sensitivities, is to start right here at this quercetin level that I was just talking about. Okay. All right. And then in terms of trying to determine if you have yeast, take a look at my article here in the yeast chapter. This one called A Silent Problem Is It Yeast? I walk through the various symptoms you would want to use to consider, do you have yeast overgrowth? Okay. All right. Lee, do you have any follow-up comments there?
Just a couple. Actually, I have been treating for MCAS with isoquercetin.
Yeah.
By Integrated Therapeutics.
Yeah.
That's interesting. The yeast I had not considered. That's a
yeah. Take a look at that, and given how inflamed you are right now, in addition to that quercetin, as I mentioned earlier, you might want to go the next step and take some Pepcid over the counter. I'm sorry, Zyrtec and Pepcid over the counter. I mentioned that earlier tonight too.
And I just the other person brought up the COPD thing. Forgive me for kind of stumbling all over the place. Is there any correlation between mold toxicity and COPD?
No,
Okay.
I haven't seen any. There's no scientific literature I'm aware of that shows linkage between the two. And I will tell you, I mean, I treated a lot of mold toxicity in the 20 years I was practicing. I just never saw anyone that had COPD with that too.
Okay, yeah. Over probably the last 2 weeks, suddenly my breathing went completely sideways, and I'm very familiar with air hunger, but not.
Yeah, let me address that real quick. So, too many yeast in the intestines, as I was suggesting earlier, activate your mast cells. They release all those histamines, and they give you an asthma-like reaction up in your air pipes.
Really?
Yeah, I used to have I have stories of people in my practice that often in my practice, when I first start treating somebody, I'm always at the very beginning, even before I ever consider putting them on antibiotics for their tick-borne infections. If I have any hint at all that there may be too many yeast in the intestines, that's the first germ I clear. And I do that because it's a quick way of lowering cytokines. And it's also, I do that because when I put them on herbal antibiotics or prescription antibiotics, I'm going to make their yeast worse, right? So I usually try to clear them first. So I have numerous stories of people that the only thing I really did on their first visit was treat yeast. And they came back markedly improved overall, but also their asthma that they had for life is suddenly gone and never bothers them again. I've got tons of stories of that. Okay. So yeah, think of the yeast maybe leading that as well too, Lee.
Oh, interesting. Okay. Yeah, I had a CAT scan today, and it's this small airway disease, whatever that might be, and the breathing is brutal.
Go for consider yeast. As I said, look at that article, and if you do have enough symptoms, I would try to treat yeast and see what that does, even in terms of your breathing then too.
Great.
All
Well,
right.
Thank you so much for your time.
Yeah, you're welcome. All right. Phoenix, I see your hand up there. You have a comment about this one?
I have a question. When you say treat yeast, what if a person can't take fluconazole or any of that? Because like I've tried taking that. The minute I took it, I couldn't breathe. Couldn't breathe from the diflucan and from the other one. You know, it's like, so I just gave up and tried like oil of oregano. But like, is there something else that's better for people with cytokine storm? I definitely have cytokine storm and mast cell problems for sure, because I did have mold poisoning in California and like 5 years ago, and I lost all my hair with alopecia from it. So, you know.
So if the drugs are too strong because they cause too much of a Herxheimer reaction, and that's what it sounds like you're saying, then sometimes you need to dial back and use herbal yeast killers to begin with.
Okay.
They tend not to give you the degree of herxing that the prescriptives can. So like the Capri Plus that I've been talking about tonight, that's a nice place to start. You could usually I have people take that if they're not having big herx issues, I'll have them start at 2 pills twice a day. But in people sensitive, I might start at just 1 pill a day, for instance. And then the other thing, keep in mind, to treat yeast, you've got to get the microbiome in the intestines readjusted. You need to get healthier bacteria in there to compete with the yeast for territory too. So, being on a good probiotic like the Metabolic Daily that I've suggested, also try to make sure you're having a diet that's rich in fibers. Those are called prebiotics, and a diet that's rich in colorful fruits and vegetables. Those are rich in polyphenols. Both of those feed good bacteria in your intestines. If you are not a plant-forward person with your diet, then you can supplement prebiotics and you can supplement polyphenols. But if you're having, eating lots of fruits and vegetables in a day, whole fruits, whole vegetables, which are not going to trigger yeast, just so you know that, you're going to be getting enough prebiotic fiber and you're going to be getting enough polyphenols too. Okay. So it isn't just the killing. You got to work on supporting the microbiome.
Yeah, for most of my life I was majorly plant-based, like extremely plant-based, and I switched to carnivore like a year ago and felt so much better that I don't want to go back because I have more energy and I feel better. So like, how do I
So in that case, and I hear it, I mean, plant-based isn't for everyone. Carnivore may work better, but you still need what the plants give you that feed your good bacteria. So take a prebiotic product, and the one I like is something called Mega Pre, which has a lot of those fibers in it, the starchy fibers that feed your good bacteria, and you do 1 pill twice a day on that. And then you want to be on polyphenols. Polyphenols feed your good bacteria. And there is a product by Pendulum, their polyphenol product. I have it at my store. And you'd want to do 1 pill twice a day of that. So if you can't get it in your diet, you can still take it other ways, basically.
Polyphenols, isn't that in the Dr. Guthrie's like olive oil or something?
I don't know. I actually don't know that product.
Oh, well, so you sell this stuff on your website in your, I can pick that up there?
Yeah, I'll just show you real quick.
Awesome. Okay.
All right, so this is my store.
Oh,
And in terms of the prebiotic, the one I carry is called Mega Pre.
Mega Pre. Okay.
All right. And actually, if you put that in, it actually pulls up the search feature is pulling up both the Mega Pre, which is this product, and the
Oh.
polyphenol booster that I was just telling you about. Okay.
Awesome. I just took a picture.
All right. All right.
Thank you.
All right. Good luck to you. All right. Let me get out of here. All right. I see two other raised hands here. So Tracy, I see your hand up there.
Just a possible other thought about what to do if you're getting a Herx from yeast medication. We have a family member who is reacting to everything, and sometimes the herbals can be harder because they kill kind of indiscriminately. So you're killing more than just the yeast, so you get even more of a die-off reaction. So what we're going to try is nystatin because it's very targeted, but in a liquid form where you can get it down to just 1 milliliter at a time. And that's on, that's a dose of 1/5 of a pill. So just kind of starting really low and staying very targeted on yeast.
Sometimes
hoping it works.
Yeah, sometimes that's all you can do is go low and slow. And yeah, I do agree. Statin is not going to pick up a lot of the funguses and everything. It's just targeted at yeast, basically. So yeah.
All right. Thanks.
Yep. Let's see here. I see a few more hands up here. Bill, what do you got there?
How you doing, Dr. Ross?
Doing
well.
While
we're talking about the yeast. Thank you. Thank you for having us all.
Sure.
How accurate are the blood tests? I mean, I know in the past I've had the IgM and IgG for yeast.
Yeah. So
how accurate?
Yeah, I don't rely on blood testing or even stool testing, and let me tell you why. So all of us have yeast that live in our intestines. We all do. It's there. It's a natural germ that lives there, right? And so just because your immune system sees what is supposed to be there and makes IgM and IgG antibodies does not tell us whether you have too many yeast going on. Okay, so it's not reliable. All right. In terms of cultures, if I have had people that have marked symptoms of yeast and not have it show up in the culture, but also if you happen to get a stool test that says you have a lot of yeast, but you don't have symptoms of it, it doesn't necessarily mean for you that you have relative yeast overgrowth. So the idea of yeast overgrowth isn't about quantity per se. It's about, for you, is it a relative too much amount? That could even mean it shows up in a normal range on a test, but normal for you, that normal range may be too much for you. It's all about relative intestinal yeast overgrowth, okay? So the only way to really tell that is look at your symptoms. Are you having more sugar cravings? Are you getting gassy and bloated? Do you have a bunch of skin breakouts because too many yeast in the intestines trigger your skin to break out more often? Are you having difficulty swallowing? Are you having a lot of sugar sensitivity? Like you have sugar and you crash every time you feed your yeast with sugar, okay? So you need to look at more of the symptoms, actually.
Just one other thing. So this is like really weird. So like when I get up in the morning, once I stand up and start moving around, I get very itchy. My back, it's always on my back. I get a lot of itching. And throughout the day, I'll get it. And I know I've heard you say in the past that that can be a sign of yeast, but I also have the POTS, postural orthostatic tachycardia, where when I get up in the morning, my heart rate goes up. It's always worse in the morning. But I'm going tomorrow for a double whammy, endoscopy and colonoscopy. I was able to once again get the GI doctor. He's going to provide us biopsies to send for tick-borne testing through my Lyme doctor, because in the past I did have Bartonella biopsied in my jejunum and Mycoplasma fermentans in my stomach. But because right now I'm on a liquid herbal, but I can't even go, like, if I stop this stuff in probiotics for 3 days, the stomach pain is excruciating. It comes back that quick.
Yeah.
Does
Yeah.
that sound like tick-borne to you, or I mean, does yeast? I haven't really read much about candida or yeast causing gastritis. That's my I have chronic
I don't
gastritis.
I don't see those yeast giving gastritis. I would, in your type of situation, I too would want to send my patient to get a look inside and see if there's anything we can learn that way.
Right. Yeah. Well, I'm doing it tomorrow. So
Good luck. Good luck to you.
we'll see. Thank
All
you.
right.
Thank you.
You're welcome. Jennifer, I see your hand up here.
Hi, I'm in my car.
Hi.
I don't see me. Here. Let me try and turn my light on. Oh, maybe you can see me a little bit.
There you go.
Hi,
Hello.
good to see you. I'm curious. So just along this yeast question is, I've been treating Candida since, well, I first saw you in 2009 and you identified it then, and I've been treating since. And I'm sure I had it like way back, even when I was in high school, and I'm 51 now, and I still have it. And I've tried all the treatments, and I have recently been diagnosed with MCAS, and I've been doing the treatment for about a year. And I did do some mold toxicity cleanup, but the Candida is still there. Do you have a recommendation of next steps?
Yeah. So, and I can't remember what I treated you with before. So
Oh gosh, no, it's like almost 15 years ago. Yeah.
So, all right. So if you have gone through yeast treatments and it keeps coming back, it's one of two things. You're either not getting rid of them all the way with the antifungals that you used, okay, or you're not and this, I don't mean blaming here, but just a person, right, is not having adequate repopulating of the intestines with probiotics, healthy bacteria that will keep the yeast that normally grow there at bay. Okay. So on the treatment side, and people that fail repeatedly with yeast and it keeps coming back, I'm usually going to want to go to a anti-yeast medication, which is compounded called amphotericin B. So amphotericin B, you have to have made by a compounding pharmacy.
Oh, I have tried that. You did prescribe that for me, and I was on that for like a year, I think about, or I can't remember how long. But I haven't tried that since I've treated MCAS.
Yeah, I would go back and do it. I would do it again for at least 2 months. Okay. And and again, you'll have to have it compounded. Okay.
Yeah.
For those of you that aren't familiar with it, I just want to let you know, if you read about amphotericin B, you're going to see horror stories about it, because when it's given in an IV form, which is how it's made for IV, not orally the way we're going to use it here, right? But IV, it's toxic to the liver, the kidneys, and everything. We used to call it amphoterrible B in medical school. All right. But it's not, when you use it orally, it's either not absorbed according to animal experiments or minimally absorbed, and you don't get into all that toxicity. 99% of the time, people have no problems with side effects with it. Okay. But it is 95% effective. All right. But the other thing I would look at doing here is being much more aggressive with gut rehab. And what I mean by that is I would look at doing this mega probiotic that I've talked about. I'm sorry, metabolic daily probiotic that I mentioned here. All right. And that I would do it as at least a couple pills one time a day. The reason I like it is the probiotics that are in it, the Akkermansia, and there's about 4 other strains of what I call fermenters. The fermenters, along with signaling from the Akkermansia, produce a lot of butyrate. And what butyrate does is it's a chemical that helps the intestinal cells work better, and they causes them to grow back together to get rid of leaky gut that you also get with too many yeast in the intestines. And that leaky gut is what triggers all your mast cell syndrome stuff. Okay, so it's got butyrate in it, and the Akkermansia sends out a bunch of signals that tell the rest of the healthy bacteria to grow more aggressively. So it helps refurbish the good bacteria there. All right. In addition, make sure you're on prebiotics and polyphenols. And those are things I was not aggressive about in the past, but I think there's great compelling data to say to do that. And so again, if you're plant-based and you can do it by eating lots of plants, colorful fruits and vegetables, great. But if not, get on Omega Pre as your prebiotic. And I would do 2 pills 1 time a day or 1 pill twice a day, either way. And get on polyphenols. They're not, polyphenols are not technically prebiotic, but they do feed the good bacteria. Okay. And then once you're off that amphotericin B, I would consider again, working with the probiotics, prebiotics, and polyphenols for a year after you're off of it, okay? And during that time, you might want to stay on something like a Capri Plus that I mentioned earlier tonight to just swat down any yeast as they might try to pop back up while you try rehabbing your gut with the probiotics, prebiotics, and polyphenols, basically.
It's a good plan.
Yeah.
So,
Good luck. Yeah, good luck with that, okay? All right.
appreciate it. Bye.
Hello, Joan. I see your hand up there too. Joan, are you still with? There you are. Hi,
Yeah,
Joan.
so I was just wondering about colloidal or nano silver in relation to yeast and Lyme and
Yeah.
viruses, actually.
Yeah. So, I don't know about colloidal silver in dealing with intestinal yeast. I just don't know. For Borrelia, I do think colloidal silver can kill it. As to whether it is effective long term, I'm doubtful because I just see it come back too much in people that use colloidal silver. The other problem with colloidal silver is there is a limit to how much you can take. You'll eventually turn blue. Your skin turns blue. And once you turn blue, you can't reverse it. So you have to be careful with your silvers that you don't build up a lifetime of damage and become a blue person, basically. So I think it's too messy, and I don't find it really works well on the tick-borne side. Again, I don't know on the yeast side, but I've always been reluctant to use it because I don't want to turn people blue.
Well, from what I understand, it's the size of it. The nano silver now does not turn you blue.
Yeah.
And
but that's a good point. But full colloidal will, unless you do the nano. But again, I just don't know of them as being good germ killers, to be honest with you.
Right, and you don't know anything in relation to viruses either, because there seems to be some correlation with viruses and Lyme. Whether one's holding down the immune system or the other, I don't know.
Mm-hmm. So just quickly regarding the viruses. So if we were to, I was at a conference this last week called the American Academy of Anti-Aging Medicine, which is really turned into more than just anti-aging. They cover everything. It's a good functional medicine, integrative medicine conference. They were showing data there that one of the viruses that people get concerned about that may be active in Lyme, it's a virus called CMV. It's actually found in 80% of healthy people. All right, so if you were to test 80% healthy people, you would find antibodies against CMV. That does not mean the CMV got active. It just means your immune system is keeping it under control, right? The other viruses would be something like HHV6, which is human herpes virus type 6, which is a respiratory herpes, Epstein-Barr. So we all know that these viruses live in healthy people, and then we go hunting for evidence that maybe they're there and active, and we measure antibodies and we find antibodies. That doesn't prove they're active because your immune system may just be taken care of the way it does in healthy people, right? So my approach to the viruses always is, and then one last thought. If you have tick-borne infections, they're going to suppress your immune system, which may allow the viruses to get more active, right? But again, we don't have decent testing that we can measure how active they are. Measuring antibodies does not mean they're active. So if my approach is to say, yeah, it's possibly a viruses, but let's go after the tick-borne infections first for a year or two, get them under control. And if we're just not getting far enough along, and you've got antibody evidence of having the viruses in you, not necessarily they're active, but in you, then at that point, we might want to consider adding in some antiviral. My antiviral I like using is olive leaf extract, 500 milligrams 3 times a day, working up to 1500 milligrams 3 times a day. And I also like to work with reishi mushrooms. Reishi mushrooms do a good job of turning on the cellular immune system that fights these kind of infections, and that 400 milligrams 3 times a day. That's my approach. I usually do that for 6 months and have pretty good success doing that.
And then just another question related to the yeast is that, do you find that most people with Lyme disease have yeast?
Yes, and from on and off, meaning some come in loaded with yeast initially, some get yeast as you start treating with herbal and prescription antibiotics, but at some point with everyone with Lyme, you've got to do something with yeast. I mean, 99% of the time.
Okay, great. Thank you so much.
Good luck. Yep. All right, let's move on here, everyone. Those are good questions. I haven't had a good yeast conversation like that in a long time. All right, let's see. Joan says apple pectin worked better for her. Good. Thanks, Joan. Oh, Joan says cryptolep has hurt my nerves too. Not sure why. I'm not sure why either. You know, there's a saying I have, many of you have heard this before, that there are common side effects that people get, and we know about those common side effects. You can read about them online. You can look up a drug directory if you want to. But then there's the symptoms that happen that seem kind of odd, and you can't find any resources that says it's a side effect. And here's my thought on that. What I've learned in managing tick-borne infections is that anything can happen to anyone with anything. And what I mean by that is there are side effects that are just unique to you. And so we just can't explain them sometimes, but there are unique to us side effects that can occur. Okay. All right, onward. Robin. Robin says experiencing fear, occasional panic attacks. What are your thoughts on using, oh, you asked me that earlier. Yeah, Bach remedies. I call them Bach flower remedies. I think can help some people with that. Okay. Let's see. Phoenix, the way you ask a question, you just type it. And just like you did that question that said, oh, ask a question, you just type your question there and tell it that, and that's how you do it.
I was trying to ask a question about the yeast thing that lady was just talking about.
Yeah.
So
and what's your question about that?
The question that I have that was really shocking to me was, you know, years ago when I was getting the diagnosis after 10 years of having Lyme, I had yeast like out of control, and I tried like everything. I mean, I tried millions of things. And then when they did this dark field microscope thing, it said I had like +4. It was like swimming in my entire body. Right. So then the doctor did something really weird where he said, well, I don't want you to worry about this yeast. We're going to treat the Lyme. And he treated the Lyme with, you know, I don't know what I used, because at the time I could tolerate antibiotics, you know, Zithromax, Doxy, whatever we used, for 6 months. And and the yeast all went away. I never treated the yeast ever. And it would all went away. And then when I did the dark field, they didn't see any of it in my blood, and I had no symptoms anymore. It was just from that treating the tick infection itself. So it's like, but then I know you can still have yeast as well. So you know, it's confusing to me, like how, you know, the yeast was there because the tick infection was so out of control and needed to be treated. Like, have you seen this before? Or like, what do you like?
So, you know, first of all, as I mentioned earlier, the way that I diagnose yeast is based on symptoms. Dark field microscopy is only as good as the person doing it, and they tend to be unreliable, to be quite honest with you. So I don't know whether the fact that they saw them in dark field microscopy was valid or not. I'll just throw that out as a comment. Okay. So I don't know if you really had yeast before, but I usually there's enough people that have Lyme and tick-borne infections that have yeast as a result of either immune suppression from having the illnesses, allowing yeast that normally live in our intestines to grow too much, or they were given steroids at some time for some reason, or they've been on antibiotics or herbal antibiotics. You're going to get yeast overgrowth from that. So that usually is more the reason that it's caused. It's from life stressors rather than the tick-borne infections directly causing the yeast, basically.
Yeah, but I just find it so weird that for 10 years I was struggling like a crazy person with this yeast. And the minute the tick-borne thing was, you know, like treated that I had no symptoms. Like it was poof, it was gone. And I thought, what in the world just happened? But obviously that was years ago. And then that tick thing was still there because I needed IV antibiotics, and I did get them in 2010 once I had, meningitis from it. But what's interesting is when I did the IV antibiotics, then I had a terrible yeast problem in my body for an entire year afterwards that almost killed me.
Yeah.
So it's like, it was the opposite of what I experienced the 10 years prior with just the oral. So I'm just like, what in the world? This yeast is so confusing,
It can be, for sure. Yeah. Thank you for bringing that up with us. I got to move on to another question here. Okay.
All right, thank you.
All right, Jim, let's see. The 3Bs and Morgellons question mark. Could Morgellons be a Herc symptom? Last week I was celebrating, thinking I was finally really getting better. Mistake, too short of you. I've been flat on my back now for 4 days. Meanwhile, I recently had 5 to 6 little spontaneously arising cuts on my hands that were inflamed and slow to heal. Monday, I had blood-filled lesion on my upper arm. Looked up Morgellons, including photos, and it seems like a match. Why would I start having these skin manifestation when I thought I was just making progress? So couple points. So in general, when people start feeling better from treating their tick-borne infections, one of the biggest reasons that they get a setback is they start doing too much relative to where they really are. You feel great. You feel like you made it. So you're out doing all kinds of activities, and that the body's not quite ready for that. So sometimes that can trigger a group of symptoms, or can cause symptoms that look like you've gone backwards or relapse. We think one of the mechanisms behind that is a process called neuromediated fatigue, where all this activity stimulates a release of nerve chemicals in the brain that flood the body and bring back all of these symptoms. Okay, that's how we think it happens, basically. So the big thing is just be careful as you start feeling better. It's not uncommon that people take on the world and then they get setbacks, and usually you're going to get back to a good place. It's a temporary setback. Okay, now regarding whether you do or don't have Morgellons, I can't tell by what you wrote here. It's usually you're going to see not just occasional cuts like you'd have in a blood-filled lesion, but you're going to have sores all over your body. So maybe it's Morgellons, maybe it's not. Everybody, Morgellons is a condition where people have skin lesions that often will have fibers coming out of them. We think those fibers are due to an accumulation of something called keratin, and it will grow out. In terms of what these lesions often will be itchy, or people scratch them a lot, and they can be all over the body. They can even leave ulcers sometimes. It can be pretty devastating. When cultures are done or biopsies are done of these lesions, there is nothing that grows and nothing that can be seen under microscope other than these keratin fibers. All right. The working knowledge, or the working belief that many of us that treat tick-borne illnesses think about Morgellons, is that it is a skin manifestation of Borrelia. And I know my colleague, Ginger Savely, who writes extensively about it, also thinks it can be caused by Bartonella and Babesia, right? So I just want to let you know, personally, I think it's Borrelia. What you will find is 90% of the time that you are working with somebody with Morgellons, they will test positive for Borrelia. And the approach is going after the Borrelia, and you will get them well. You can heal up Morgellons by going after the underlying Borrelia, okay? And possibly Bartonella, possibly Babesia too. So I don't know why you started having these. I don't know that it definitely is Morgellons here, but I can tell you.
I don't either.
Yeah, I can tell you it's not uncommon to go backwards after you start taking on things. So hang in there. You'll get back on the good path again.
All right, thank you.
Yeah, good luck to you. Yeah.
Oh, how do you raise your hand on this system?
So there's down in the bottom, where is it here? So if you go down to the bottom navigation menu in Zoom, you'll see an icon that says reactions, and next to it is one that says raise hand.
Oh, it's not on my version. I'm on Windows.
Oh, it's not? Huh. I'm not sure why it's not there.
I see mine has participants, chat, react, share, AI companion, nothing, no raise hand. Okay.
I wonder if in the share, if you were to hover over that and see if raise hand shows up there.
It says host is not allowing multiple presenters sharing for this meeting.
Okay. I'm not sure why it's not showing up there for you, Jim.
All right.
All right.
I was looking for it also. If you hit react and then it brings up some icons right at the very bottom, it says raise hand.
Oh, okay. So they buried it. They buried it.
I found it.
Okay.
Thank you very much.
Thanks, Teresa. Yep. All right. Let's see here. David C. Let's see. I'm 75-year-old man dealing with chronic inflammation, major brain fog, weight loss, and sleep issues. I had a tick bite in 2004, not diagnosed until 2009. Lots of antibiotics, herbals, 39 hyperbaric chamber treatments until 2019. A DNA connection test, March 2022, is negative. Currently taking low-dose naltrexone, Ketotifen, lorazepam to help with above issues, and constant right upper quadrant pain. Only been a month, but inflammation seems to be slightly lower and sleep is better. As part of a LabCorp CD57 panel last year, my primary ordered a Lyme blot serum. Of the 10 shown, all were absent except for band 41 and band 39, which were both labeled present abnormal. What does that mean? All right, so first of all, I'm glad you feel a little bit better. That low-dose naltrexone that you're on has the ability to regulate the immune system effect, which then can lead to lower inflammation chemicals called cytokines. So sometimes that can help with pain that way. It also binds to some receptors in the brain on a brain immune system cell called microglia. And these microglia have a type of receptor called a toll receptor. The LDM binds to the toll receptor and gets these microglia to stop transmitting pain throughout the body as well too. All right, so LDN's nice because it can lower the cytokines and it can get at the brain signaling pathways that send out a lot of these pain signals as well too. Okay, regarding your question, so the Lyme blot that you're describing sounds like they did a process called a Western blot. And so what happens in a Western blot is we grow the standard way it's done through LabCorp is you grow one strain. They grow one strain of Borrelia in the lab, the original East Coast strain from the 1970s, which is why they miss a lot of it because they're not testing for all the strains. We actually think there's 8 strains that cause it, but they're using only the original East Coast strain. You grow these in the lab and you kill them and you take their proteins. And you take those proteins and you put them on a porous test strip, and then you run electricity through that step, and all the proteins that weigh a certain amount go to the same position. So all the proteins that weigh 41 kilodaltons show up at that position of 41. And all the proteins from the covering of the Lyme germ that weigh 39 kilodaltons show up at position 39, okay? And then we're looking to see of all those different positions where these proteins migrate to, which ones do you have antibodies against? And the way we find that is after we distribute the proteins, we then take a sample of antibodies that we know, or we take your blood and we take your antibodies and we smear them across the test strip. After we do that, we take a coloring agent that attaches to antibodies stuck on Lyme proteins, and now we can start seeing things. And we see, where do you light up? At which positions do you light up? Okay. Now, we recognize that there is a pattern that would be diagnostic of Lyme. And one of the standards that is used is to look at bands 23-25. Some labs call that 25, some call it 23, but it's the same protein. So 23-25. Let me start over again. 23-25, 31, 34, 39, 41, and something called 83-93, those 6 positions. And if you have antibodies against at least 2 of those 6 positions, that is technically a positive test. But let me explain where I'm coming up with that. So recently, so the test you had done, they don't use those standards. They use a totally different standard, okay? And their totally different standard misses it. But recently, IGeneX got the CDC to approve the new interpretation criterion. It's a new FDA and CDC finally approved a new interpretation criterion, which is 2 of those 6 bands. It's now approved by the federal government. A lot of doctors don't know it yet, but it's approved, okay? On an IgG, if you have antibodies against 2 of those 6 that I just said, 23, 25, 31, 34, 39, 41, or 83, 93, any 2 of those, that's a positive test. So by the newly approved standards, you had a positive Lyme test, okay? All right. David, do you have any question there? All right. Robin, I see your finger was up there, a thumbs up. I hope that was a good sign for what we were just talking about.
Absolutely. Thanks a lot.
You're welcome, David. Good luck to you. All right, let's see. What else do we got here? David C. Deverin, also dealing with SIBO and toxic mold. Okay. Thanks for letting us know that too. All right, Meg, let's see. I know you've discussed ferritin levels in the past. Why is this important? Is it a blood test to determine your level? And if you're low, what can you take? Okay, so ferritin is, again, it's the storage form of iron in the body. When you have people with fatiguing illnesses and body pain illnesses, at some time in your evaluation, they should have checked a ferritin level to make sure that you didn't have a condition of the liver called hemochromatosis. Hemochromatosis is a condition where your liver becomes loaded, your body develops too high, very high levels of ferritin that eventually injures the liver, which leads to fatigue, body pain, etc. Okay, so the issue with ferritin in terms of causing health problems, one side of that is massive amounts of ferritin means hemochromatosis, okay, which and iron, if it accumulates too much, is also inflammatory too, just so you know that, okay? All right, the other side of ferritin is it's a very good indicator of body stores of iron. And we need iron not only for hair growth, so low iron leads to hair loss, okay? But iron is a cofactor, a necessary chemical in a lot of chemical reactions that drive energy in the body, okay? All right. So we find in fatiguing illnesses or in hair loss that people tend to do better overall with their health if we can keep their ferritins at least 40 or higher. And yes, sometimes you have to supplement either with pills or injections to get it that way. Okay. All right. Anything else there then, Meg?
I had a follow-up question if you looked at
Sure. Yeah. Go
it
ahead.
was just, I recently had the new T-Labs Babesia test.
Yeah.
Came back negative for Babesia yet again.
Yeah.
But when I stopped the atovaquone, I started feeling crummy.
Yeah.
So I started it again. I've tested 5 times negative for Babesia. So I was just wondering if you feel the new T-Labs test is a good test?
No. So in testing for any of the infections, okay, Babesia, Bartonella, Borrelia, we can classify tests as being either direct tests, meaning we see it with our eyes in some fashion, all right, or indirect tests, which are tests that measures your immune system reacting against it. Okay. All right. We're measuring an immune reaction. If we have the immune reaction, then that says the germ must have been in you or still may be in you. Okay. All right. On the direct test, the problem with any direct test, whether it is a blood test looking for the DNA of the germ in you, that's called a PCR test, or it's a test where we apply a genetic marker that lights up the genes of the germ, like is in the new T-Lab. I think they're using a genetic marker when they're looking under the microscope too. All of these, or a culture is a direct test. The problem with Babesia especially is your body doesn't uniformly shed Babesia all of the time. Sometimes it's in the blood, sometimes it's not. And you have to have sufficient amounts of it in you to even be a level that could be detected in the blood, all right? So the problem with any direct test, whether it's a culture, PCR test, enhanced PCR culture, anything that's looking at it directly, these tests may lack adequate what we call sensitivity, the ability to see a germ when it's in you. Part of it is when you stick the needle in your arm, the germs just may not be swimming by the needle at the same time, okay? And for any of these direct tests, none of the labs can tell us what the sensitivity is. We don't know. They haven't been able to measure it, okay? By comparison, immunoblot, which looks at antibody reaction. Antibodies are everywhere, even in minuscule parts of blood. We don't need a germ to swim by the needle because antibodies are everywhere. We can measure it. Anytime we put a needle in you, we can measure those antibodies, okay? And or another type method called a ELISpot or T cell reaction test. Again, T cells are everywhere. They swim by the needle, okay? Right. Those tests are more sensitive because they're measuring an immune reaction that doesn't necessarily go away, all right? And the sensitivity of, for instance, the IGeneX immunoblot is 95%. They can find an infection if it's in you 95% of the time. We have data that tells it it's a sensitive test. The new IGeneX AccuDart test, which is an at-home test, is, I think, 85% sensitive. It's not perfect, but for an at-home test where you stick your own finger and mail it to the lab, that's pretty good, okay? So I know I've had questions about the new AccuDart. AccuDart is being run by IGeneX under a different company using their same test immunoblot method, but that's 83, 85% sensitive, for instance, okay? Which still may be better than the T-Lab and those direct methods, all right? Yeah, all right.
Thank you and happy holidays.
Yeah, thank you, you too, Meg, thank you. All right, everyone, that's it for me for tonight. Again, I'm going to be off next week because next week is Christmas at this time. And for the week between Christmas and New Year's, I'm trying to decide if I'm just going to go 2 weeks off or if I may host it, but it would have to be probably on Tuesday. I'll let you know in the next days whether I'm going to do that or not. Okay. All right. But in case I don't see everyone before the new year, and definitely, I know this is the last time I get to talk to you before the Christmas holiday here. For those of you that celebrate it, season's greetings. I hope everyone has a good time through these 2 weeks of this year. All right. All right. Bye, everyone. Good night.